Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. Today we have Dorey Demers. Dorey is our Rise Vermont coordinator, overseeing all the Rise Vermont efforts. She brings a strong background in public health, having previously worked in the St. Albans District Office for the Vermont Department of Health, and we welcome you back to the community. And so today we're going to talk about Rise Vermont. I put that in the introduction, and people are going to say, well, what is that? So what is Rise Vermont?
Yes, well, thank you for having me.
Welcome.
I'm excited to be here, and I'm excited to talk to you a little bit about Rise and what we've been doing. So Rise Vermont is it's a community movement, and it's really made to amplify what's happening within the community in relation to physical activity, nutrition, healthy eating local foods. So it's supposed to help us all make the healthy choice the easiest choice.
Sounds so easy.
I know. Right?
That sounds like an easy job. So how long have you been with Rise Vermont, and do you have a team that works with you?
Yeah, so I've been here since January, and so the last couple months, we've really focused on getting our team started. So we're going to have health advocates, which are going to be in communities, and they're going to be kind of getting people involved and starting the movement and getting people excited about making healthy choices the easiest choice. And we are also going to have health coaches, which is going to work with individuals and families to really look at what they're doing within their homes and individually to make healthy changes.
So you mentioned the word the movement. So what is this? How is this program? Do you have some initiatives that are starting, or what's actually happening?
Yeah, so it's exciting. So our goal is that we want everyone to be rah-rahing for healthy choices. You know, we've got Scorecards, which is going to really help families get excited about making healthy changes in their lifestyles within their homes and with their kids. So there's different activities that they can do, which is going to jazz them up and hopefully keep them moving. And also some giveaways and some celebrations that they're making these healthy changes. For schools and businesses, we're really trying to make those connections with them and work with them on making policies that support healthy environments within their organizations.
Great. So, you know, I open up the messenger now, and so I see this kind of Rise Vermont, and so it must be piquing everybody's curiosity. So is there going to be some community education or a rollout or something? So how are we going to get it out there, what it is?
Absolutely. So we're going to start in June. That's our official launch. But that doesn't mean that you have to wait until June. So we're getting everything ready to go. So we're starting conversations. We're getting pilot families that are up and running, trialing out what we're trying to do with Scorecards, and our individual health coaches are working with them very great. So for the next 3 months, we're starting that momentum and starting that movement. And then come June, hopefully you'll see a big splash of Rise Vermont. We're really active on social media to get people involved as well. So it's really starting that momentum, because ultimately we want to make this a movement. We want healthy choice and healthy eating and healthy physical activity to be what people want, and to really strive for that within their community.
So it says, I think you used the word pilot.
Yeah.
And so a pilot family, what does a pilot family look like, and what are you doing within that pilot?
Yeah, absolutely. So we have a ton of pilots right now, which is great, but we're always looking for more. What we do is we sit with families and we talk about what they're doing in their family life, if they want to make healthy changes, and then we give them tools to support healthy changes that they might want to achieve. So we've got Scorecards, which is going to give them some fun, different things that they can do as a family to try to help them make those healthy changes. And then we also have some individual tools as well, so that it's kind of all-encompassing.
Okay. So this little scorecard, so it sounds like I've got to, if I'm here, how do I get to here? Do you have an example of what might be on the scorecard? Like if I'm not drinking water, does that I need to drink 8 glasses of water, or what does the scorecard look like? So is it is it something I can really do, or is it too much of a stretch? Or
Yep, we've made it achievable, but also kind of hard to make those changes. So it's supposed to challenge people to really look at their family life with each other and say, okay, how can we make this change? So some of the items for a family might be, let's eat together as a family 5 nights a week.
Okay.
Let's be soda free for 7 days this week, all 7 days. Let's make fresh drinking water the choice of beverage at our dinner table. Let's try a new vegetable together. So it's supposed to be these easy but very achievable things, and supposed to stretch families as well to really think about how every day they can incorporate healthy choices and behaviors in their life.
Excellent. So the schools and children, really trying to, if you're talking about change, it's great to get started young. So how are schools involved in this program?
So we have the scorecards. We have scorecards for different entities. Schools is one of them. So we have a school scorecard where our advocates that are located within communities will work with schools to kind of go through a checklist of, are you offering healthy snacks during the day? How often do you have recess? Is it daily? So really looking at the overall health, and they're all best practice approaches from the Center of Disease Control and they state, these are things that you should be doing in your school to make a healthy environment. So we go through that with them, and we give them a level of either gold, silver, or bronze. And what will happen is our advocates hook them up with the resources for each one of those items. So let's say a school is interested in having healthy snacks at their school. We will hook them up with our Healthy Roots coordinator to get the farm to table initiative going within their school.
Wow.
So it's really connecting resources
Perfect.
within communities.
So making it real and sustainable, not just sort of we'll do it today, but really getting those resources there.
Yep.
So what about the businesses? So you got the children, and so the parents who are working and so busy that, thinking about sitting down with all the children's activities. And so how do we get to the businesses so that we can also work with parents and in their changes as well, so we can marry this up?
Yeah, I mean, the whole premise of RISE, which is what I love, is it's wrapping around the individuals and families in every aspect of their lives.
Perfect.
So it's wrapping around them in their schools. So when children, leave their home where they might be adopting these healthy behaviors, they're supported at school.
Yes.
The same thing with the businesses. We're hoping, as they make changes as an individual or a family, they're supported in their business. So just like the school, we have a scorecard for businesses where we'll go down and sit down with them and have those discussions. So for example, we recently piloted with a business, and we're able to connect them to community supported agriculture. We're bringing CSAs right to their work site. We're hooking up with fresh drinking water initiatives. So they're gonna look into getting bubblers at their work site, which is awesome. So it's really connecting them. So when people do leave their home, they're supported. We have a wraparound approach.
Super. So you had mentioned social media, and so how do I get connected?
Yeah, and that's
Early.
and I think that's the biggest thing is we want to be connected to everybody right now, and forever ultimately. I mean, social media is such a great way for us to share our stories, to offer some online support for us. So we are on Pinterest, where we're sharing different recipes. We have some walking paths. We're on Facebook, we're on Twitter, we're on Instagram. So there's a whole host of options for people to kind of connect with each other. And the goal of social media for us with Rise Vermont is for people to see that other people are trying to make these changes too, and to see what else is out there for resources.
That's great. So you can just go on and put Rise Vermont, and that's what it's under?
Yep.
Great. That's awesome. So what do you hope to accomplish in the end? I know this is a grant because we've talked with Judy Ashley. I know she co-chairs the overall committee, and I know there's a grant involved with this. And so what do we hope to achieve with the grant by doing all of these interesting things?
Yeah, I mean, sustainability is always a good question, and we want to start this movement so at the end of 2 years, people are still wanting this. And what I love about this is that wraparound approach. And so we're embedding ourselves in not only just individuals and families, but schools and businesses. And the hope is as we make these connections, other people want to join, and more people want to join, and more people want to join. So it becomes a movement. So people are excited, and it's Rise Vermont, and they want to rise to the occasion and embrace healthy lifestyles.
So I notice it's Rise Vermont, and we're in Franklin and Grand Isle County. That's what we're focusing on. So how does the connection to Rise Vermont?
Yeah, so the program has been created to really it can be replicated. And the hope is that it'll branch out to other areas of Vermont and hopefully become this statewide initiative, which is great. So we are focused on Franklin and Grand Isle counties at this point. Just because we want to really focus in, that's where our grant is there, but we can definitely see, and the committee has been wonderful of saying, this is something that could go statewide, absolutely.
Yeah, it's awesome. I can feel your energy. So talk a little bit about your passion. Where does all this energy come from, and how do you connect with this program?
Yeah, I think we've all been there in our lives where, we make a healthy change and we see all this success. And then 2 months, 3 months later, we're falling right back into the same habits. Or, we've all lost 20 pounds, or, our kids are being physically active, we're as a family. And then it's just easy to fall back into unhealthy habits because we're not really supported in our schools and our businesses to the best that we can be. So my passion is I want the healthy choice to be the easiest choice, not just for me, but for my family and for their friends and for their school, because ultimately, we are all in this together.
Right.
So it's hard, and it's a difficult challenge for everyone, but how can we make it easy, and how can we make it fun, and how can we provide that support to each other so that we are making healthy changes and they are lasting?
So you're a nurse, so how does that help you connect with where we're going with this program?
Yeah, nursing has, I've gone from a career change. When people look at my job now, they say, that's a nursing job? Well, prevention is so huge. I did inpatient care before, and I loved it, and it's so important. What I found was that you were seeing the same folks over and over again. So I grew to a passion for prevention. Wow. And that's where this has really brought me. And this is prevention. We're trying to prevent people from getting sick. So it's exciting.
And to be doing it in your own community must be just a great feeling for you.
It is. It's wonderful. I mean, Franklin and Grand Isle is just a great place. We have wonderful community partners, and they're all sitting at the table.
That is so true. That is so true. We can't go this alone. It's really, the community's ready for it because there's so many incredible community partners doing so many pieces of this.
Yeah.
And you're kind of knitting it together and giving that energy, and that you're cheerleading too. I can just feel. I mean, who wouldn't want to be part of it with all your energy? We'll follow you anywhere with that energy. So what's coming in June? Can we talk about that at all?
Yes, we absolutely can.
So what's happening?
So we are going to have a pretty robust website. So that's when that is going to be launched. We're also going to be releasing our scorecards to everyone.
Ooh,
so there'll be some ways to get involved. You'll see how we're going to be collaborating with schools and businesses to get those scorecards out. We want people to try it out during the summer. So it's really going to be that big launch of everything's ready. Now here we go. Let's start this movement together.
That's awesome. And I bet we'll see you at the June Dairy Days and things like that. You will see you all in the fabrics of all the different communities.
Absolutely.
Well. Excellent. Well, Dorey, the time has flown, and you've been such a pleasure to talk with, and your energy is infectious. And so I am so happy that you've joined Rise Vermont, and it will be a success because that passion is certainly going to bring it totally alive across Franklin and Grand Isle counties, and whole of Vermont.
And all of
We're going to
Vermont.
rise Vermont.
We
together.
are.
So thank you so much.
Thank you.
So this is Jill Berry Bowen, CEO of Northwestern Medical Center, and thank you so much for joining us for this exciting program, Rise Vermont, and let's get out there together and make those healthy choices.